All right, we are now going to go to nurse practitioner, Ms. Charisse Chitolie.
Hello, everyone. What a pleasure to be here. My God, the value of the knowledge and wealth that you have presented and the past panelists have presented is overwhelming. So thank you, Charmaine. Angels are networking for sure. Thank you. I come to you today. I wanted to talk to you about, my name is Charisse Chitolie, and I am a nurse practitioner, family nurse practitioner. I work in mental health, but I co-own IV Hydration business. And with this IV Hydration business, we do a lot of education. So I just wanted to give some quick notes. I'll share my screen with you so that you can see that one of the things is hydration is imperative. Whether you get it by mouth, drinking, or the IV company that we have, and we can come out. And of course, we want everyone as a client, but I want to make sure that you understand the importance of it and how you can get it. So let me share my screen here. Are you seeing that?
Yes.
Okay. Okay, good, excellent. So I'll start with the IV intravenous.
One second, Charisse. Let me go ahead and ask Lisa to please mute. Just while we got a little echo. Okay, go ahead, Charisse.
Okay, good. Are you here? All right. So of course we can go again by mouth or IV. And the importance of that is 60% of our body is made up of water. So if we're talking about, oh, I'm thirsty now, guess what? Your body is already in dehydration. If you're looking at your skin, because it affects every organ of your body, and with skin being one of the largest organs of your body, it is imperative to hydrate. So your kidneys, which can flush your toxins, if you don't have enough, the minimal amount, and when we talk about minimal amount, we're talking about everyone having half of their body weight in ounces of water daily. That's the minimum amount. That's unless the doctor has said to you, you're restricted from fluids, or you have a chronic condition that restricts you from fluids, okay? Other than that, everyone should try to keep in mind to take in this amount of fluids daily. Physically, if you are even the minimal dehydrated at 2%, it decreases what you can do physically by 20%. So when we understand the importance of taking in the correct amount of water, we become more purposeful. And that's what I want to impress on everyone. Mentally, you're more clear. If you're dehydrated at any point, you start having signs and symptoms that interfere either with your working or your working out or anything that you're doing on a daily basis. So cognitively, it will throw you off. Visually, you're not able to see as well. And these are, sometimes they're long lasting effects, but other times they can be corrected immediately. And that's with drinking enough fluids. So weight loss, I know that all of us have a problem with that, and all of us think about that. And cognitively, if we're thinking about it, we need to be purposeful. And I feel like with being purposeful, I've put together some things that I do in the morning with alarms. You start with 2 glasses of water a day. When you get out of bed, that just helps you. That gets your organs, all of your organs moving forward, and starting to hydrate yourself. Because when you're telling me I need to have this amount, if you're 100 pounds, 50 ounces of water a day is a lot if you're looking at the big picture. So break it down. Let's say I'm going to do 2 in the morning. I'll do 2 in the afternoon. I'll do 1 before lunch or a half before lunch. Yes, I know. Nurses, we have not been able to even take a water break most of the time. A lot of people are on your feet. You have jobs where you're doing things that you're unable to, but we have to be purposeful. We only get one body. So with that being said, I'll talk about intravenous, which is the quickest and the most effective way to optimize your wellness and your health. But if you are doing the other things, if you're taking your weight and if you're being purposeful, taking your water and being purposeful of drinking, then you don't have to have this IV. A lot of times we do this just to replace and replenish things that you have worked off, or those that have not been able to take in water by mouth, okay? If you don't like water, which is the main thing that I get, everyone says, I don't like the taste of water. So I tell them, let's start with 1, putting in place something that reminds you to drink water daily. And what we've done is we have a water bottle that helps with that and telling you how much. If you give me a 22-ounce water bottle, I'm not going to drink all of that more than likely. But if I'm able to see how much I'm drinking because the lines are there, that helps a lot. But if you're going to be purposeful and you don't like water necessarily, then let's do this. Let's add watermelon to it. Let's add strawberries. Let's infuse the water so that it meets your cravings of this sweet part that everyone needs. And it also meets your minimal water intake daily. That's one of the things that has helped me, and it's helped me help others just by informing them, especially my patients. Cut your watermelon up, cut your strawberries up, use cucumbers, use lemon. We know lemon water is a diuretic, it's a natural diuretic. So there are so many benefits in doing this. And I just kind of wanted to bring that to everyone's attention, but sometimes it happens, sometimes it doesn't. But you can always improve your water intake by doing some of these things that you may or may not like. Listen to your body. If you're feeling thirsty, if you're dizzy, if you're lightheaded, excessive fatigue, whenever you are on medications, it's imperative that you continue to take your water in so that you're able to flush. Your kidneys are able to flush the toxins. It's able to do what it needs to do. So that's another reason to be purposeful about water intake. Water, our hydration help is one of the things that I do. I'm not, for any one of these, but I used any of those, and I use Crystal Light as well so that I can flavor my water. So these enhancers will help with that, and it helps with your intake if you just adamant about not taking regular water in. Okay. So with that being said, I'll take any questions, but I want to make sure that everyone understands that if you're taking water before your meals half an hour, it cuts back on how much you're taking in. If you're doing it first thing in the morning, it helps with getting your body moving forward. If you're taking in water before or after workouts, of course that hydrates you. It helps because when you're sweating, you're losing water. Going to the bathroom, you're losing water. So you always want to go back to a par level of water and hydration. And first thing in the morning, of course, and before you go to bed. And these are our water bottles. So at the end, I will be here and let you guys know how you can get it. But we're going to give it to one great listener participant today. If you have any questions or concerns, you can always reach out to us. And we are at iHydrate.com. So it's info@iHydrate. It's one of our sites. We're also on Instagram, and you can reach us on Instagram at iHydrate. We're on Twitter. We're on Facebook at iHydrate.
Charisse, thank you. You can stop sharing your screen and all that information. Stop screen share. All that information, go ahead and put it in the chat. So because people would not have caught up on that. That's where I would like everyone who would like to be contacted and followed up with our audience members to go ahead and put your business information in the chat. And Charisse, I tell you, I feel like I need to leave the summit and go and get more water and more water after all that water presentation. So thank you for that information, especially the part about eating fruits or other cucumbers or things with water content. That was very insightful. Hopefully at the end of this, Charisse, let's go ahead and tell some more about iHydrate and the different type of IVs that you offer, okay? When we get to the prize section. Thank you, Charisse. All right.